From aching knees to stiff hips, joint pain is something millions of Americans live with every day. But for some, relief may come in the form of surgery. So we're taking a closer look at that today. Who's getting it, how the technology has changed, and why more patients are recovering today faster than ever before. Dr. Joseph Moratt is an orthopedic surgeon with Franciscan Health. Thank you so much for joining us.
Of course, yeah. Thanks for having me.
So when you operate on someone and replace the joint, what are you actually doing? What are you putting inside?
Yeah, so the problem with hip and knee arthritis is that the cartilage surfaces that are supposed to be super smooth surfaces get worn down, and so we have to replace it with something that's just as smooth. And so usually we're going in and removing most of the joint and putting in metal and plastic surfaces that look a lot like that joint.
And I would imagine that this process has really evolved over time.
Yeah, it's pretty dramatic how different it is today than what it was like 10 years ago. I've been doing this for 10 years, and the implants have gotten better, the way we get into the joint has gotten better, the way we machine the space and put in the implants have gotten better to the point where now we're using things like robotic arms to help us prepare it and implant the devices in exactly the right place.
Wow. It
all just makes it so that it's an easier, better recovery for the patient.
Yeah, well, how much faster are people recovering once it's over?
And that's changed a lot too, and that's a lot to do with the techniques and technology, but it's also how we think about these operations. We do a lot of work ahead of time to get patients ready, to make sure they're medically ready, but also just prepared for what comes afterwards. And what used to be an operation where you'd be in the hospital for 3 days, now you come in on the day of, and most patients go home the same day. They're standing up, they're walking within hours of surgery.
Wow.
And yeah, that deep inside joint pain from hip or knee arthritis, it's just gone the day of surgery, so they want to be up and trying it out.
Yeah. How do you know when you need joint replacement?
Yeah, so I tell my patients it's never a need as much as a want, right? So there'll be a point when you have bad enough arthritis where it's a problem in your life, and eventually it'll get to be a problem that can't be managed with medications or injections, and then it just starts interfering with life in a way where you'll decide that I'm a candidate for a joint replacement and now I want one.
Let's talk about life after surgery. So you talked about the quicker recovery. What is life like? Are there limitations? Or am I going to have to do anything differently?
Once you're fully recovered, for the most part, no. In the early parts, you have to modify things a little bit just to protect the implants, just to have a smooth recovery through. But once you're about 3 months out, it's back to life as normal.
All right, our conversation is going to continue online. You can catch that at WTHR.com/realmenweargowns or anytime on WTHR Plus. Dr. Joseph Moratt, thank you so much for being here.
Of course, yeah, thanks for having me again.
Low temperatures this morning were once again close to 70.